Hey everybody, welcome back to the channel. We've got a brand new Keynote by Palantir. This was actually sent to me today by a follower on Twitter. So shout out to Luca for sending me this. Keynote by Palantir Technology was uploaded today, December 12th, 2022. It was in Europe and it was at MedTech World. MedTech World, let's just go to this right here, apparently is a conference around medical technologies, and it's been a conference that's been around for a while. And this was their 2022 conference. Obviously, a lot of information. Palantir has been argued to be one of the most undervalued healthcare startups in the world. They just got to deal with the Cleveland Clinic for 10 years, Tampa Bay General Hospital, doing a lot of interesting stuff in the healthcare space. I have not seen this, so I'll be reacting to it live. 9 minutes, 23 seconds. Let's see what Palantir had to say at MedTech Europe 2022.
Hello, good afternoon, everyone. My name is Joanna. Is your mic on? Just checking. Okay, cool. And we are both software engineers by background, but it is currently our honor and privilege to be able to lead the healthcare division at Palantir Technologies. And for those of you who haven't heard of us, and actually, can I have a show of hands? Who's heard of Palantir? 1, 2, 3. Okay, I see 3 hands and a lot more people, and that's exactly why we're here today, to tell you a little bit about who we are, what we do, what our company is all about. So Palantir Technologies was founded in 2003 in Palo Alto in California, currently headquartered in Denver, Colorado, and we are a software company. So we have 2 data platforms. One is called Foundry, the other is called Gotham, and our customers use that software, those data platforms, to drive transformational change. And those customers come from both the public side and the private side. So what we're going to talk to you about today is really the idea that data alone is not enough to drive transformational change. And really, it's data empowering decision makers, creating a feedback loop into a single source of truth that really drives that change. And this is, of course, particularly difficult in the healthcare world because of the inherent complexity across healthcare. And we will talk about that complexity and kind of our views on it, but first, maybe give you a little bit of context on our work in healthcare.
So Palantir is trusted by some of the world's largest healthcare and life sciences companies around the world and institutions around the world. Some examples include NIH in the US, where Foundry is used to help accelerate critical research. The US Department of Health and Human Services. This is where Foundry is used for vaccine allocation, both COVID and now more recently monkeypox. Also, Sompo in Japan Foundry is used directly within nursing homes for personalized responsive care. But I think perhaps some of our most advanced work is actually at the NHS in the UK. This is where we've had our software used since 2020. And some examples here include over 9 billion items of PPE have been distributed across the UK through Foundry. Over 121 million vaccines have been distributed, allocated, tracked through Foundry. And this is also with over 15,000 users across the country. And then also helping to alleviate the elective backlog, one of the seminal challenges that we have today, with over, for instance, 30% reduction in the inpatient waiting list at Chelsea Westminster, one of many hospitals that our software is currently deployed at. Now, it's really through these challenges and through these experiences that have allowed us to more deeply understand the inherent complexity within healthcare systems.
And just to Just to kind of dig into that complexity, what do we mean by complexity? How can you start to tackle it? How do you start to categorize and subdivide it? I like to think of 3 kind of categories of complexity, specifically in healthcare systems. You have system complexity, you have organizational complexity, and finally, and potentially most importantly, you have decision complexity. So system complexity refers to the technical infrastructure that underpins the healthcare world. things like EPRs, things like staff rostering system, things like primary care data systems, things like data warehouses or various other kind of mid-tier data management layers. All of these different systems make up the world of a healthcare institution, and so there's a lot of complexity. Even if you look within one healthcare system across different sites, there's a lot of complexity with what kind of the systems they're using, how advanced are those systems, and what does that look like. So that's the first. The second complexity is organizational. This is who makes up your healthcare organization. This is how many clinical staff do we have? How many administrative staff do we have? What do the general managers interact with my data? How do my schedulers interact? All of the kind of the people that make up healthcare institutions are going to look different, again, site to site. That's another layer of complexity. And then the final layer of complexity is those decisions. When we think about healthcare institutions, it's not one or two or three people making decisions that you then kind of need to use data to make those decisions. It's thousands and thousands and thousands of decisions being made every single day at every single level across healthcare institutions, and that's really how a healthcare system's runs. It's with every single person making those minute decisions every single day. So how do you address that complexity? What principles can you use to both kind of optimize the healthcare system overall while we're working within and for those boundaries of complexity?
So it's really threefold. The first is the creation of a single source of truth. And this is really the integration of all of that highly disparate array of source systems across a health system. Everything from legacy mainframes through to modern cloud infrastructure, and of course, everything in between. And this is not only the integration with all these systems to have that baseline understanding of how things are progressing across your system, but it's also to do so in near real time, or as near real time as possible. So all decision makers have the same access to the same data, of course permissioned off, but at the same time. An example of this in our work has of course been the vaccine supply chain, where we have over 15,000 users across the nation, everyone from executives at NHS England level, understanding the overall performance of the program, all the way down to vaccine center managers, understanding the performance of their own center and perhaps the locations nearby, maybe for mutual aid circumstances. The second is a mechanism for decentralized decision making, and this is really allowing the infrastructure to have decisions across entities. So for instance, across hospitals to community or primary to acute, allowing these decisions to manifest is something that's a deep architectural problem. Now, one example of this that we currently do is discharge and making sure that you can improve that transition of discharge into the community. And this is where we've integrated not only in the acute, but also the local authority, and then finally care homes, bringing those together and allow decisions to take place. The final part of this, of course, is the provision of write back. And this is, again, a deep technical problem. You have to make sure that when you talk about radical interoperability, you're not just referring to read only, you're also referring to write back. That allows those decisions to actually be generated.
So real quick, I know we have 2 minutes left of this presentation. It's very, very interesting so far. Core thesis that they're talking about is top-level complexity of data-driven decision-making. Very complex. Thousands and thousands of data points happening, thousands and thousands of decisions need to be made specifically in a healthcare institution, whether it's like distributing a vaccine across an entire country or just the hospital that has to deal with backlogs and things of that nature. The two arguments so far that they've gave on how do we solve these systems and how do we solve and harness the full power of healthcare systems at the intersection of something like Palantir's Foundry is creating a single source of truth. This is the ontology argument. This is one of the big investment theses for Palantir, that they are able to create a single source of truth within your organization, take all that disparate data, put it in one place and make it usable, which is what gives it value in the first place. And second, provide a mechanism for decentralized decision-making, which is the interoperability of data. I mean, you don't need to go there to make a decision because you have the data here, which means you can make a decision from here, even though your coworker is over there, right? That's what it means to have a decentralized distributive mechanism to make a decision without having to constantly be in touch with a central authority, because all that data is already decentralized, even if it is in a single source of truth, giving anyone from accounting to sales to logistics to supply chains to the doctor to the nurses to be able to understand what to do with with that data at the end of the day. I was actually just in the hospital this past week with some family, and I saw nurses trying to make decisions and putting in data into these different, data spreadsheets. Essentially, it wasn't Excel, but right, they were trying to figure out how to log data in and then make decisions with that data. All of this is happening at the levels of billions per second when we're talking about the entire global healthcare system, where hospitals, institutions, clinics need to make decisions. If you could optimize that, not only is that a big market to go after, but that's a big thing you could do for patients around the entire world.
And the final is the most important. This actually underpins the previous two, and that is ensuring privacy and security. Now, in the NHS, one way in which this is achieved is through purpose-based access control. Now, what is a purpose? A purpose is set by data governance teams to contain data specifically scoped to meet a user's goals. No more, no less. Data governance teams will provide the rationale behind granting access to any particular individual, and data owners will provide the rationale behind the inclusion of any particular data asset. And it's this constant record keeping of between these different user groups, automated through the platform, that allows you to have a deep, enriched understanding of who has what, who has access to what, when, and importantly, for how long. And it's really through these three key ingredients you can manage that inherent complexity across a health system and ensure collaboration that is safe and secure.
At Palantir Healthcare, we're really excited about the opportunity to contribute in some small way to the transformation that we see the healthcare industry going through. It's been really energizing to be here the last few days. We're just downstairs. Please come see us. We always like to talk. So you know where to find us. And
okay, that's pretty much it. The last thing you said was about ensuring privacy. Obviously, that's another key component to being able to make sure that healthcare institutions, right, feel safe with even using that software, because you've actually kept data private, which is the whole NHS dispute going on right now with Palantir. It's like, are they going to be able to keep data private? And if they're not able to keep data private, then that's why they wouldn't use something like a Palantir. Obviously, I think Palantir has shown more than enough that they can keep data private. The question is if the governments and the people actually allow the NHS to do this and not, boil them down because they're working with the evil data company like Palantir. So great keynote, makes a lot of sense. High level stuff. This is interesting. It's one of their go-to-market strategies. Obviously, being at these conferences, you've kind of got to be there. This is where a lot of B2B sales happens. A lot of brand recognition happens. A lot of companies get to know who you are. I mean, they were probably talking to people that had never heard of Palantir in the healthcare space. So that's the beauty of social media and content platforms. It's like one video about what they just did. What if it reaches 1 million people? Right? It's like that's the overarching difference between going to a conference and meeting 50 to 100 people that might get you some business, or having your video seen by 50 to 100,000 people. Obviously, you got to leverage both of them, but Palantir is trying to make more of a presence around the world and educating people about their brand identity and their brand message, and giving top-level, high-level overviews about what the healthcare system needs and what Palantir can provide, and hopefully that ultimately leads to more business. Those are my thoughts. Just saw this new keynote. Thank you again, Luca, for sending this to me on Twitter. There it is, Palantir at MedTech World. Thank you so much for listening and watching. Let me know your thoughts. I'll see you in the next one.